DMH Newslink, your trusted source for the latest in healthcare news.
DMH Newslink.
This is DMH Newslink, and I'm Michaela Hunt. We're fortunate to have Dr. Blackwell with us today, who is one of our partners. He's an SIU medicine urologist. We thank you for spending some time with us today.
Thanks for having me.
We're going to talk a little bit about prostate cancer and some new technology and screening techniques. But first, let's talk about the old techniques. Were they not as reliable as what we're seeing right now?
So the standard screening for prostate cancer involves two things. It's a physical exam as well as a blood test, PSA or prostate-specific antigen. And that notoriously isn't as reliable as we'd like it to be. There are several things that can cause a PSA value to be elevated. Having a urinary tract infection, a man having an enlarged prostate, which is pretty common in the age group being screened for prostate cancer. Any of these can cause a falsely elevated PSA and can lead to unnecessary biopsies.
So what is this new technology and how is it more helpful to you?
So the new technology is an MRI of the prostate, and it's something that we have at Decatur Memorial Hospital that we're able to use. A patient undergoes an MRI. Our radiologist is able to take a look at the prostate in a lot of detail and identify any lesions that may be suspicious for prostate cancer.
And it sounds like this can help you with a more definitive diagnosis, given what you just explained.
It does. After a patient has an MRI and we have those lesions marked out, I'm able to look at those lesions and specifically take a biopsy of those lesions, which leads to increased diagnosis of the clinically significant prostate cancers, those that a man would want to have treated.
So you mentioned biopsy. Let's go a little bit earlier in the process. How is what the technology, the screening technology looks like right now, how is that helpful in that patient comfortability factor?
When a man comes in with an elevated PSA, the next step would then be a prostate biopsy, which is obviously an invasive procedure. At this point, when a man comes in with an elevated PSA, I'll have them get an MRI of their prostate, again, to get that information for any suspicious lesions prior to undergoing a biopsy. That way we can avoid any unnecessary biopsies.
Now, who needs to get this done as we're talking about this with this group who's watching this right now?
With our national organization, the recommendation is men aged 55 to 69 are really the ones who are going to have the most benefit from prostate cancer screening, and again, that involves a physical exam as well as a blood test. For men at a higher risk of developing prostate cancer, either African American men or men with a family history of prostate cancer, they may want to start at an earlier age, even up to 50 years old.
Great insight. Dr. Blackwell, thank you for being with us for a few minutes today. We appreciate it. For more information, go to dmhcares.com/news.